plastic surgery for traveling patients, there are a lot of things that I do to try to make it easier on them. I often will talk to them before they come and visit me over the phone. Often we'll have consultations over a web service such as FaceTime or Skype where we can actually discuss face-to-face. I don't necessarily perform examinations on patients over these electronic communication agencies because I want to make sure that I have a chaperone, because that's just to protect both of us. But what we'll do is we'll talk, and sometimes we may talk several times because I know it's hard for patients to travel for a consultation and then come back and travel for surgery and then come back and travel for recuperation. So there's a lot of talking over the phone, a lot of planning, a lot of coordinating, especially with my coordinators and my nurses. But I really try to make myself available for these patients. So that's the first thing that you need to make sure that you do and you have with your surgeon if you're going to be willing to travel for plastic surgery, is you want to have an accessible surgeon and get the care that you need. The next thing is figuring out the nuances about traveling for surgery. You have to figure out how you're going to get to the surgeon's office. You have to travel to the airport and get transportation from the airport to our office. We help you with that. And then you have to have some sort of lodging facilitated, whether that be an overnight stay in our hospital or an outpatient surgery center, and then a hotel stay afterwards, which we help you with. And you also need to have somebody there to kind of help take care of you. You could potentially take care of yourself, but you need to have someone there for the first little bit because you're going to need some help, especially if you're going to get full-on general anesthesia. The next thing that I try to do for their postoperative care is I try to keep them around town so I can check them about 5 to 7 days after surgery to make sure everything is okay and that they're safe to travel and leave. After that, I try to have them come back and see me. Sometimes we have to take out stitches and things like that. If they are from farther away, I can use absorbable sutures so that they don't need this. And then when I do their post-op checks, I can check on them virtually through some of the internet communication services. And then depending on how things work, every once in a while, if I'm traveling to an area and I have patients there, I will check on them and visit them. The main thing is make sure you can get good care. I'm a little hesitant to recommend true medical tourism like out of the country because it's very hard for you to actually receive and get care. Luckily, I know a lot of plastic surgeons in the U.S. and that if I had an issue, I could have you see one of my colleagues, and I usually know a plastic surgeon at least in every state, or I can actually contact them because we're in the same society so we can help each other. So I hope this helps, and I wish you the best. Thank you.